All right, folks, it's 3:30. Good afternoon. I'm Sheriff Tony Thompson. I'm the Plans and Operations Chief for the Emergency Operations Center here in Blackhawk County. And today, Thursday, our briefing is going to be focused primarily on business and business operations as it pertains to the COVID-19 virus. We do have, as kind of a spin to that, we also have some focus on childcare issues and some of the resources available with regard to that from one of the COVID task teams and the task force from Childcare Provider Network. For our first presenter, as always, I'm going to introduce you to the incident commander for our Emergency Operations Center and the Director of Public Safety here in Blackhawk County, Dr. Nafissa Cisse-Egbounye.
Good afternoon. So to begin, there has been one additional case of COVID-19 reported in Blackhawk County since our last press conference. And as always, the health department staff are working to complete the follow-up with the individual and identify their close contacts for self-isolation. Additionally, the governor's proclamation was extended to April 30th. Today, what I want to do is to focus on what we need from our community to help stop the spread of COVID-19. So over the past 2 weeks, I've spoken several times about the need to practice self-isolation and social distancing. The health department, the EOC, and the entire county is really relying on everybody to follow these guidelines. We will not limit the spread of COVID-19 and if each and every one of us is not doing our part in practicing social distancing. So if you have traveled outside of Iowa or to an affected area, we need you to stay at home for 14 days. If you live with someone who is ill with fever or respiratory symptoms, please stay home. If you are ill with fever or respiratory symptoms yourself, stay home. Limit social gatherings to 10 people or fewer, and stay 6 feet apart from others while you are in public. Wash your hands frequently. Cover your cough and sneeze with a tissue or your elbow. There are many, these are the minimum things that we need to do to stop the spread of COVID-19. This is a time to really stay at home as much as possible and to limit our contacts to others, to go straight home after work, to have one person go out for groceries instead of the whole family, and to avoid extra travel. This message is to our business partners. We need you to play your part as well. We understand that this is difficult. I have communicated that. We understand the economy is hurting, the businesses are hurting, but without your help to stop the spread of COVID-19, the outbreak will continue and it will be tough. It will be longer and longer, and so we really need you to play your part. We need you to encourage your employees at all levels to remain home when they are ill, to remain home if they have traveled, and to remain home if they have an ill family member. You can encourage your employees to stay home by being flexible with your time off and leave, and by allowing those that to telework. We need you to practice social distancing at work and protect the health of your employees. There are many ways that businesses can implement social distancing within their organization. You can promote telework, stagger shifts, discourage the use of shared workspaces, use conference calls or web-based platforms instead of in-person meetings, and reduce public traffic by promoting online services, drive-up, and curbside services. Other practices such as screening employees at the start of shifts and increased cleaning can also be used to protect the health of your employees. It is important to put your employees in the best place you can, to limit their contact with the public and one another, and to allow them to be home if they need to be. Every day, the health department is receiving calls about different gatherings, people going to work after they travel, people standing outside in fast food areas, people going to work when they are sick or family member is sick, people being required to go to work when they know they should be self-isolating, and people in general not self-isolating. Businesses, we need you to play your part. This is very important. If you don't, this crisis is going to take longer and it's going to be very difficult. So the health department, the EOC, our elected officials, everybody is asking you to please do your part and protect the health of your employees. This pandemic will not end without your help and without all of us doing our help. So I am going to repeat, I will continue to repeat this, that we will not succeed if we don't receive your help. Everybody has to take this seriously. So the health department and all our partners in the emergency operations centers were working together to respond to the COVID-19 pandemic and to protect the health and safety of our county. So we need you to do the same thing by staying home, practicing social distancing, and following self-isolation guidelines. Thank you and have a good day.
I would like to build on that generalized theme towards the end that Dr. Nafissa touched on, and that is businesses and workplace safety during this COVID-19 pandemic has become kind of a forefront issue for us here at the Emergency Operations Center as of late. Contact from workers considered essential, workers' families, and businesses and business owners seeking better guidance and information on how best to handle their business operations, what practical practices and protocols during this crisis have become kind of the norm for us here during our operational periods at the EOC. We appreciate both the concern and the focus that has been given to workplace safety, alterations of workplace policy and procedures during these trying times. However, there does seem to be this faction of the community that is focused on these restrictions and the governor's proclamations as some sort of riddle or a puzzle that needs to be solved or somehow creatively approached for circumvention. This is absolutely the wrong approach, and it will end up hurting the very people that you're trying to find ways of helping. At the very basic level, the governor's proclamation is very simple. The health department's guidance is very simple. If you don't have an extreme purpose for being out, stay home. Period. Churches. I recognize that we're entering the Easter season and that this is a horrible time to not be able to shepherd your congregations. But what will be worse is if you're left to plan for a congregant's funeral or have to be left out of the hospital for visits caused by trying to work creative approaches around the government's guidance for simply staying away from each other right now as the waves of this virus crash all around us. Coaches, I know you want to help your young and budding athletes, and I know that you see potential and opportunity in these days of wasted isolation. We've received calls and concerns, and it's not for me to pass judgment on any practice or workouts or any other thing that you choose to do, other than just to explain to you very plainly all that potential that you think you see in that young budding athlete is being placed in jeopardy every time you bring them together. All the help and good intentions that are being presented are quickly undone by all the risks which cannot be mitigated when congregating your team or your athletes. There is a greater lesson to be learned in this pandemic, and that is the greater good. There must be some way to get everyone out of their own personal, individualized focus and brought up to this 50,000-foot view of the societal impact caused when we intentionally bring people together right now. Even when it is done with the best of intentions, for all the right reasons, the risks simply do not exceed the rewards. All those who simply must co-locate right now should be the only ones doing so. This virus is not a problem for us to find a workaround for. It is a very real, very dangerous, very present, aggressive predator. just waiting for its next victim, and any organization trying to find creative ways around the social distancing protocols is merely contributing to the spread of the virus. It is both irresponsible and dangerous practice to encourage such activities and planning. For now, socially distance, protect your family, protect yourself, and stay at home. With that, I would like to introduce the CEO from the YMCA and a member of the Black Hawk County COVID Childcare Provider Task Force, Angie Widner.
Thank you, Sheriff Thompson. I am here to obviously represent the YMCA and our current efforts in providing emergency childcare for essential personnel, but more importantly, I'm here to represent providers across the community who are doing that work and who are positioned under what is our initiative to address emergency childcare needs in our community. The initiative includes a couple different teams. Number one, we have a provider team, and within that team, we're gathering providers across the community that are really faced with new challenges in how we deliver childcare, and mobilizing also to respond to anticipated needs for essential personnel who will require childcare to do their work that they do that supports our community so importantly. We also have a team that is our employer-provider connection team, and our work in that team is to bring together employers of essential personnel, and we define essential personnel as individuals in healthcare, public safety, government infrastructure, food service, and those that care for vulnerable populations. And so we want to assist those employers who have concerns about how to meet their employees' childcare needs, particularly as some centers and providers across the community have closed, how they can ensure that their employees have adequate and great childcare support so that they can count on them to be there to do their jobs that are so very important right now. Childcare looks much different in the era of COVID-19. I can speak to what we have happening at the YMCA. We have transitioned our YMCA into an emergency childcare site. We have families who have come to us in the past couple weeks who are responding to having their own childcare centers or childcare arrangements change. We also have families who obviously with school out have increased needs that they didn't have before. And so we have converted the YMCA, and there are a lot of other providers doing that similar kind of work. At this point, we have very strict safety protocols. No one comes into the building unless it's a child that we're serving or a staff member for the Y. Our drop-off and pickup occurs at the front of our building. We do temperature checks for every child and staff member walking in. Everyone uses hand sanitizer immediately. We've reduced even parent sign-in and out by having staff handle that so we don't have multiple people touching pins and clipboards. We disinfect the bottom of shoes at this point as well. And within our program, we have no more than, for school age, we have no more than 9 kids with 1 staff member. It's smaller ratios for early childhood, which is always the case. Some 4-to-1 ratios and 8-to-1 ratios for the younger kids. And so in those kind of home rooms, as we call them, they really are positioned in those rooms for the day. We have some shared spaces in the Y that they're able to use, but never at the same time. So we try to restrict particular staff members to work with their particular group for the entire week, so we limit the amount of intermixing that's happening. We don't let groups mix across the day, so even if there's another group using the restroom at a particular time, the other group holds until that is safe for them to go use. We also have staff who are solely dedicated to sanitation. So they spend the entire day disinfecting surfaces and anything that would potentially have been touched. All of our doors are open, so we really have reduced those touch points as well. So we, the other thing I want to comment about that too is that we are engaged in a lot of staff training right now, and our staff are signing acknowledgments of our increased protocols. And the other thing that we've asked all of our staff, or basically required, is that they acknowledge that they are following the strictest social distancing guidelines that the state and the county are providing. So we and many other child care providers are doing everything we can to ensure that those centers are safe and that they remain healthy for the kids that we serve. We've been asked, why would you stay open for childcare at this time? And I mentioned it a little bit in the beginning, but the reality is that some people can't stay home right now. Their jobs are really at the forefront of this issue. And so, as Governor Reynolds noted, childcare is an essential service as well, particularly at this time in supporting essential personnel. I want to direct the community and employers as well to a community survey. It's a childcare needs survey that you can complete if you have an individual family childcare need. But also we're encouraging employers of essential personnel to complete that or to access that survey. We have a Facebook page I'll mention in a minute. Access that survey and send it out to your entire employee groups. When we first organized about 3 weeks ago, our steering committee includes Mary Jansen with Childcare Resource and Referral, Dr. Jane Lindeman with the Waterloo School District, and also Pam Ziegler with the Cedar Falls School District. When we first started meeting, we started to understand that there were a lot of individual efforts taking place, hospitals assessing the childcare needs of their own staff and other places. And so what we've really tried to do is create this community-wide initiative to really fold it all together so we can really assess the need and respond appropriately. So we have a Facebook page. It is, you can find it if you go onto Facebook and search at BHC Emergency Childcare. That survey is posted on that. I think it's also the most recent post. So employers or individuals can access that survey and let us know what your childcare needs are. The survey results get routed to Childcare Resource and Referral. They follow up within 24 hours for every survey response, every individual who notes that they have a childcare need or they may have a childcare need, and that's been important for us to kind of assess. We have childcare centers open right now that are not at capacity and who are very well under capacity, including the YMCA. And I can tell you from being a part of the provider team meetings that we have a group of providers, a lot of providers in town who are committed to staying open, even when from a business perspective that may not make sense, but from a social responsibility perspective it certainly does. And we don't know what the next several weeks will bring, and so we are anticipating that there may be an increased need for childcare, and we are going to be there and prepared when and if that need, and we hope it doesn't, but if it does, we will be ready for that. A little bit just briefly about the kind of approach our initiative is taking at this point. We have a tiered approach. We're in tier 1 still, which means that we have childcare providers available that have slots. Childcare Resource and Referral can help parents get directed into those slots. And so right now it's kind of a matchmaking with current needs and then also the slots that are available. A tier 2 approach would take us into a place where the current providers that are still operating childcare have reached capacity, and both of our school districts, Cedar Falls and Waterloo, have committed to offering one or more of their buildings and offering space and working with community partners to offer childcare within their buildings, which is one of the reasons we're so glad that they're part of this effort, because they have certainly come to the table early and willing to assist in that way. And then a tier 3 would be, finding additional schools, additional locations in the community if we had to. So we obviously hope to stay in tier 1 where we can meet the needs with our current slots that are available. But we are prepared, and we're thinking 2-4 weeks ahead of what this could look like and preparing for that. So that's a little bit about our emergency childcare initiative, and we're doing our best to support particularly those essential personnel, and we thank each of them for the work that they're doing. I just actually today featured on the Y Facebook page a new family that we have attending the Y, and I had a chance to talk to the mom when she was doing drop-off, and she's a CNA at Bartles Lutheran Home, and her child care center closed, and she said that she would have had to reduce hours, and that would have created a understaffed situation for her organization. And so that's an example of what this means for those essential personnel. So thank you.
Our next presenter is the Honorable Mayor from the City of Cedar Falls, Mayor Rob Green.
Thanks, Sheriff Thompson. I'm very glad to be here along with Mayor Hart to talk a little bit about business operations in Waterloo and Cedar Falls these next couple of weeks, especially how the governor's proclamation of March 26th impacts local business. There's been a bit of confusion here, so I hope we can clear some of this up today. The governor's proclamation of March 26th states that only the following businesses, organizations, and activities are required to be closed, at least through April 7th. There's 25 of them that I've counted. Bookstores, clothing stores, shoe stores, jewelry stores, luggage stores, cosmetic, beauty, and perfume stores, florists, furniture and home furnishing stores, restaurants and bars, fitness centers, health clubs, health spas, aquatic centers, swimming pools, wading pools, slides, and wave pools, spray pads or splash pads, bathhouses, salons, medical spas, barbershops, tattoo establishments, casino and gaming facilities, senior citizen centers, senior citizen daycare facilities, and then mass gatherings of over 10 people, including spiritual, social, recreational, leisure, and sporting events. So in Waterloo and Cedar Falls, we understand this proclamation to mean that all other business types, organizations, and activities are legally allowed to remain open. Other business owners are encouraged to close or to allow employees to work from home or to make other operational changes, as Sheriff Thompson mentioned. It's very important that we focus on the intent of the proclamation and not just the letter. If we're going to overcome this public health emergency with minimal exposures and deaths, it's critical that we as a community follow these closure orders. And as I've said before, closed means closed. Now, with that said, guidance provided by the governor's office to the Iowa Economic Development Agency states, a retail store that the government has closed under this proclamation must have their establishment closed to the public. However, these stores can still sell by to the public online or by telephone with delivery or curbside pickup of their goods without opening their store. So in Waterloo and Cedar Falls, closed to the public is being interpreted to mean that local businesses and organizations in those categories I mentioned may still carry out activities as long as their actual facility is closed to public admittance. Also, individuals participating in outdoor activities with open spaces independently of others would not be interpreted as a mass gathering. So as an example, 50 people walking on a recreation trail would be permissible as long as social distancing is maintained, and 6 feet of separation is strongly recommended. Also, I've learned that some activities of more than 10 people are allowed by the governor. The Food Bank of Northeast Iowa received this guidance from the governor's office, which will inform county enforcement efforts, as I understand. She said, the governor said, this order does not prohibit gatherings of more than 10 people to provide essential services such as food preparation or delivery. It's still encouraged that these gatherings practice careful hygiene and social distancing to the extent possible, and the functions performed in limited numbers. For example, if 50 volunteers gather at the same location to provide essential services, like volunteering at the food bank, it would be appropriate to split up into 5 groups of 10 and maintain 6 feet of distance between individuals. In cases where social distancing or 10-person limits are not being practiced, or where special issues or limitations exist, certain facilities may additionally be closed, or activities prohibited at the city level during this public health emergency. For example, the mayors and superintendents of the area closed publicly accessible playgrounds due to the real risk of virus contamination of playground equipment. I'll also note that social distancing is not currently a legal requirement, nor is staying at home. But again, I can't express highly enough that staying home and social distancing are our best defense against spreading the COVID-19 virus. And I'm counting on residents to follow this protocol and potentially save their loved ones, friends, and neighbors from illness or death. Studies have shown that COVID-19 is spread by people who seem perfectly healthy. You may currently be a carrier and not even be sick or ever get sick. That's one reason why this coronavirus is so dangerous. It's a stealth virus. That's why it's also important that you act as if you're already a carrier and limit your interacting with others. The governor's proclamation goes part of the way to limit retail interactions and business interactions, and the rest is up to our own good judgment, common sense, and appreciation for why this proclamation exists in the first place. Mayor Hart.
All right. Thank you, Mayor Green. Thank you for the dual message to our local businesses. And thank you, EOC, Sheriff Thompson, Dr. Nafissa, and thanks to all that are here this afternoon. So I just want to take a moment to kind of reiterate that this moment requires the participation of all in our communities. From the businesses that are being asked to close, knowing that the margin for error is slim to none, to the single mothers and fathers barely making ends meet, to children wanting to go to playgrounds and play on equipment but can't, to the frontline workers in all of our businesses and the frontline workers in our city departments that are risking their lives every day. We thank you. And I know that there may be some out there that believe that the measures that we're taking are cruel and unusual punishment, or that some of us may be a little bit power hungry with telling people what they can and can't do. Well, let me tell you a little secret. That's absolutely not the case. Today, we are making a call to the people of the Cedar Valley. We're making a call that we don't take this situation lightly or for granted. And just because we haven't seen the overall swell in cases at this point does not mean that we should not take this serious, because the actions that we take today will forever change the direction of our communities. And this is not a call or a time to panic, but it's a time to think and watch what we do. This is not a time to overreact, but nor is it a time to underreact. So at this moment, we're making the appeal to all of you to be safe at home. And keep in mind that does not mean that you are stuck at home, but we want you to be safe at home. So please analyze how many interactions that you have and limit them in the in-person interactions. If you are a business that is doing takeout, take a look at how you prepare food by practicing safe preparation. If you're a business wanting to protect your employees, mark your floors, rearrange your break rooms, and study the CDC guidelines to protect everyone. And everyone adhere to social distancing, and please stay safe at home. And as a nation, a valley, and a community, we can overcome this challenge if we continue to work together.
Folks, that concludes our briefing for today pursuant to your questions. Yes, ma'am.
For Nafissa, is this new case travel related or related to the other cases at all?
Nope, it's not related to the other cases, and it's travel related, but because we confirmed we have community spread, it doesn't make a difference.
I had a question for both mayors. With the governor not doing a shelter-in-place order, do either of you wish that she would? And if so, why or why not?
If you take a look at this morning on the New York Times, I think there were 38 states across the country that have some type of stay-at-home order. There was another 7 states that had particular districts within the state with some type of stay-at-home order as well. And on Monday, our city council and councils are going to work towards putting a proclamation together along with the county that we can ask the governor to adhere to some types of stay-at-home or safe-at-home practices. And I know thus far we've done a lot. If you take a look at the report that Mayor Green has just read and all the practices and things to keep our community safe, but I think the appeal to staying at home and at some point the level of enforcement to keeping people at home will be the most direct way that we can mitigate the many challenges that we face. So it is my appeal, it's our appeal that we want to see some type of safe at home. The challenge is, though, also really quickly, is when you take a look at the word shelter in place, you take a look at the words stay at home and you take a look at our word, safe at home, that means different things to different communities. You know, there's more restrictions in maybe on the East Coast than there is on some parts of the West Coast and within the central part of our communities. But regardless of what that is, we know that the safest measure would be safe at home. So we're asking the governor, I'm asking the governor to please take that next step forward.
What does safe at home look like in terms of how it compares to shelter in place?
Well, all of this is semantics, right? Because when you're talking about shelter in place, that has different semantics. And we've had other governors elaborate more eloquently than I can. You know, and then stay at home is a way to encourage people that the best, most safe place for you to be is to be at home. I'm of the belief that if we follow the social distancing guidelines, if we only move around when we need to go to a doctor or essential travel, I believe that one of the most safest place that you can possibly be is at home. So I say safe at home, because that's what we're encouraging people to do. And shelter in place and those things, you're not stuck at home. Just believe that you are safe at home, and that'll look different for every community. And we're having conversations. We have governmental conversations with the EOC led by Sheriff Thompson when Mayor Green, the mayor of Evansdale, and other mayors get together and talk about if this is, what are some common things that we can do together as a community to build stay at home. So I just, you know, semantics mean a lot to the mentality and to the psyche of our communities. And we want to make sure that you're not stuck at home, but home is one of the safest places that you can be during this pandemic.
And I guess same question to you, Rob, if anything differs from what Quentin says.
Well, I just want to reiterate what Mayor Hart said about the fact that it's semantics, but semantics are important. And I just brought up one safer at home order that I've been looking at from the state of Wisconsin there's safer at home provisions. It's about 16 pages long, and it has very nearly the same items in it that we're already doing through the governor's proclamation. So as Mayor Hart mentioned, our councils and my council too, hopefully we'll have a discussion on Monday night to determine if it makes sense for us to push the governor for a safe at home order, stay at home order. I can see both sides of it, but I believe that we're at the point with community spread that as I look out on the streets, I see people out and about, and I get the sense that because there's not a stay at home order, there's less of a sense of urgency and concern from residents. So as we talked about in our mayor's meeting this morning, I think it was Mayor Hart that had said that any action that we can take, even if it is just a label of, okay, now we're under a stay-at-home order or a safe-at-home order, if that helps to get people to comply or to appreciate the need to be at home, then it's worth it. So I'm looking forward to that discussion with our council on Monday evening. I invite you to tune in. We will have that meeting electronically on Monday night, and so you're more than welcome to join us on that.
So is this just a matter of maybe if Governor Reynolds is resisting a shelter in place because of the verbiage? Is this sort of a way to maybe backdoor that and sort of get her to have a shelter in place but calling it something different, so maybe she's less resistant to that? Is that what's trying to be happening?
Well, it sounds like that's the sticking point. I'm certainly not in conversation with the governor directly about it, but my understanding is that there are considerations of what's the question? What does that actually mean? What changes with a stay-at-home order? Do we get into the idea of the essential businesses? Because as I mentioned earlier, there is a specific list of businesses that are types of businesses required to be closed. All others may be open. So if we go to a stay-at-home order and that changes to essential businesses only, then that brings up that question of what are those essential businesses and how do we decide and how do we enforce that as well?
And one thing that I want to reiterate, because oftentimes conversations, whether it's mayors, whether it's governors, some of these conversations can be politicized because people may be on the different spectrums of the aisle. But I think 372.14, item number 2 on that list, talks about our ability to be able to publicly protect our communities, and the steps and the standards and the proclamations, all those things that we're able to do to protect our communities. So I think when you take a look at some of the other states that have been gravely impacted at exponentially higher than we have, they've issued stay in place, shelter in place. So what that says to me is one of the most aggressive ways to be able to mitigate what our communities are currently facing is a shelter in place. That's what people are doing. And so we haven't, in our county, we've been fortunate. We've had great leadership, and we want to keep our numbers low. But we want to protect our communities and believe that we have the constitutional rights to be able to protect our communities in the most aggressive manner in which we believe that we can do so, in which the way that our citizens have elected us to do so. So the decision and the conversation for our parts has nothing to do with the political aspect. It's just talking about how we can have safer communities and how we believe that we can protect our citizens.
If the governor refuses, are there steps you can take?
If the governor refuses, that is absolutely her right to do so. But we have a responsibility to the citizens that elected us to protect our communities. And that's why we're having conversations locally about what can we do, what messages can we get across to our businesses, to our citizens. How can we work with our school districts to protect playground equipment? And we're going to do that. And that's what we were elected to do. So if she accepts it or not, that is her prerogative. But Black Hawk County is going to work as hard as we can and aggressively as we can to protect our citizens.
Would that be including a possible shelter in place if needed be, or a stay at home, whatever you like?
That could be a stay at home. That could be a myriad of different ways, and not every mayor within Black Hawk County may agree with one another, but overall safety and concern and the responsibility that we have been given by our citizens, everyone is passionate about. So if it requires a stay at home because of Chapter 372.14, then we're going to do it. But we're not trying to do anything that supersedes our governor's authority. That's not the purpose. The purpose is about the senior citizen within our community who is most at risk. That has to do with the expectant mother who could potentially be at risk. That has something to do with the school children in our communities. And so all of our vision and focus is on all of those particular populations that make up our communities. So that's what we're going to do. And that's our focus. So that may be a safe at home, but we're going to protect our communities the best way we believe we can.
Yeah, just to agree with that, a stay-at-home order would certainly be a tool in our toolbox that the mayors have. I would prefer not to use that at the local level. If we, as Mayor Hart alluded to, if it's driven at the state level, it makes coordination and enforcement that much easier because we're all on the same page. But I definitely take to heart that a stay-at-home proclamation, or basically anything that comes out of emergency orders or emergency proclamations, they're political acts. And it is the responsibility of the political leaders to carry those out. And looking at, heard it said that history or politics is history in the present tense. And so what we're doing now, we will be judged on years from now. And so I want to make sure that the decisions we make are certainly based not with emotion and not with fear, but with that sense for what is in the best interest in our communities. And the mayors have that charge to know that, and our councils have the charge to know that. So again, we'll I definitely consider that as an option for us if necessary to do our own stay-at-home order. Again, I'd prefer not to.
Tony, from your perspective, if does a stay-at-home order, first of all, a statewide stay-at-home order, would that help you in terms of enforcement on these businesses that you're talking about?
Well, from an enforcement standpoint, first of all, let's be very clear. This is a difficult thing that you're asking. When you need definition, you need very clear guidance, you need very clearly defined left and right borders and limits, and you know, it's one of those things when we've seen it play out different ways in different states, and so we're very attuned to what's going on right now. One of the things I'm prideful of here at the EOC is being able to host those conversations with our elected officials, and this is probably the closest that our elected officials across the spectrum, from municipality up through county and even state government, were participating this morning, have worked. And so to have them collaborating and have all of us dialoguing and communicating as freely and as closely as we are right now, unfortunately, it's about this topic, but it's something that I'm prideful of, that the EOC is facilitating that kind of effort. But the reality from that enforcement perspective is this is a tough thing, and you just can't say it and expect it to be done. When you say it, you have to make sure there's teeth in it. When you say it, there has to be penalties associated with it. There has to be things affiliated with it that ensure compliance. Otherwise, we're still running around playing officer friendly, trying to cajole and encourage and champion and cheerlead. And that's kind of what we're doing right now. And for the most part, we're getting compliance, and for the most part, we're getting understanding. But for those that don't, again, I kind of address that with the people just trying to be creative and trying to be helpful, but it's really not. And so, yeah, I think you've hit the nail on the head when it comes to the enforcement side of it.
If there was a shelter in place, you would be able to enforce these?
Well, if there's a shelter in place and it comes from the state level, it is anticipated that from the state level comes this extra layer of definition, comes this extra layer of teeth, comes this extra layer of expectation and understanding, as well as just codified enforceability. I'll call it that.
And in terms of if there were to be a stay-at-home position brought on by any of the cities within Black Hawk County, how then would enforcement then have to sort of vary by city lines, or how would that look?
I think, well, so by city, that's what we're trying to avoid, and that's why we all met this morning, and that's why we met last Friday, and that's why the EOC continues to facilitate those conversations, as was indicated. Maybe not every mayor is completely on board yet, and so we're working on that consolidation, we're working on that consortium, and we're certainly working on making sure that once everybody is congregated and in agreement, we're able to move forward in one lockstep fashion. And it's one of the values of having the emergency operation function the way it is. And again, I've not seen this in my history, in my tenure, the 26 years I've been involved in Black Hawk County government, to see this kind of cooperation at this level. It's pretty remarkable. Absolutely.
And just with regards to Mayor Green's comments, and with Sheriff Thompson about businesses, overall, at least the businesses in the city of Waterloo, and I would assume Cedar Falls, have adhered. They have done a tremendous job under critically important economic times, and this has been tough on so many people. And we get those conversations. We have people call the offices. We try to put up resources through the SBA and try to let people know and our businesses know that we understand, but this time calls for different actions. But also, just really quickly, making sure that our citizens know that have been placed in tough situations. You're going to be evicted in this particular time, or this is going to happen, or you can't pay this, knowing that there's resources available. Our Human Rights Commission is available. Iowa Legal Aid is available to hear the stories of our citizens and to be able to give some type of reference on what they could do in challenging times. So we want to make sure we continue to highlight those resources as well.
This question might be for Nafissa or Tony, whichever one might be able to do it. The governor released metrics today that they're using to assess sort of those benchmarks that they're talking about. And so Northeast Iowa was rated at a 7 out of 10, so we're similar to Southeast Iowa was also rated a 7, but that's among the highest in the state. Do you have access to those metrics in your countywide planning as well, or are you using different metrics?
No, we're using the same metrics, and we're ranked at a 6.
A 6.
Mm-hmm.
I had a question for Angie, if I can. With the mayor's or governor's announcements that the schools are closed until the end of the month, is there anything that child care providers are doing or plan to do to help with the education of school-aged children while if both their parents are working?
Yeah, I heard the governor's remarks, and it sounds like the state is working on how they can support districts and then leaving it to districts to then determine how they're going to proceed. And so certainly I think in the area of childcare, we play a role in enrichment, and we can support kids learning in a different way than schools do. And we are obviously doing that within our childcare programs. I can only speak for the Y regarding this. I can say that we're currently working on packaging some weekly themed, easy to do at home activities that we can share out to our families, and even anticipating an opportunity for those who may not be able to print materials at home. And if we had a print handout or something, we would have a pickup case at sitting outside the Y. And so we're working on that as an example of the ways in which we can support. There's lots of great resources online right now that have been shared from parents who are home with their kids and looking for a way to keep them engaged. And so, we'll be kind of curating some of that material and seeing what we can do in our own way, in the way that we, within the realm of informal education and enrichment.
Angie, how many kids is the Y currently serving, and how many do they have capacity for?
Yeah, we currently have 28 kids in our care right now. And I don't have the number of our capacity offhand because it's changed. We normally operate an early learning center out of our YMCA all year round. And then, of course, we have before and after school programs out at the school sites across Cedar Falls and Waterloo and Dyke as well. And so we have converted a lot of spaces at our Y. We moved out exercise equipment in certain spaces. So we have a lot of standing rooms right now that are ready to be childcare rooms but are not currently. So I think that if we were in the realm of like 60 elementary age kids that we could serve. So and then our ELC typically has a capacity of 40, but one of those rooms has been two staff, but 16 kids, and we're not allowing any more than the total of 9 kids. But to keep that ratio, we would be at 8. So our ELC capacity is down to 32. So 80 to 90 slots at the Y.
And what are the ages that you go up to?
We have everything from 6 weeks. We have infant classroom, pre-TODS, TODS, preschool, and then on up to elementary.
Tony, with the business closures being extended through April 30th, can you just go over again what your expectations are for businesses in Black Hawk County affected by that order?
So I do want to touch and reiterate much of what Quentin Hart said. The mayor is right on the money when it comes to the importance of articulating that we recognize most of our businesses are doing it right. And most of the businesses that we've had contact with or that have reached out to us have actually been soliciting resources and assistance. And we appreciate that as well. So being able to help them with ideas on social distancing, whether that's marking out squares on the floor, if they're working in certain areas, hey, this is my square and this is the area that nobody else enters, and that kind of helps keeping the floor clear and clean and away from each other, or just ideas. The CDC has a great resource for small businesses that we want to, we put that out for you folks and referenced it, but it's a great resource that goes well beyond what we kind of copied off and provided for you. But there are a lot of expectations. There's a lot of things on businesses right now. I would even encourage a business owner right now to give themselves a gut check. Are they truly essential? Because again, when I have those conversations and they say, hey, I'm really essential. I have a staff of 5 and I'm really essential. And the trinket and fob that I sell is really important to 15 people in the state of Iowa. I would caution you that maybe you're not as essential as what you really think you are. So being able to raise them up, back them off, and bring them to that 50,000 foot view for just a moment, and recognize that when we say essential, it means something different to everybody. But during this time of crisis, maybe there is an opportunity to take a quick break, take a deep breath, and reassess and reevaluate where you truly stand. If they are essential, and there's a ton of businesses and organizations out there that are, then do everything within your power to protect your staff. Go out of your way to go overboard in protection. And if you don't already have PPE, get it. If you haven't, purposely put in place, I think it was mentioned, take half the chairs out of the break room. Slide the tables into the corners, make it such that you're not encouraging co-location that would be jeopardous. We recognize, and unfortunately in our career field, we recognize that we are essential and we have to be there. But there's a lot that we're doing that is unprecedented. There's a lot that we're doing that is so far outside of the norm for our operations that as soon as I'm done here every day and I temp in every morning, I still have to go back to the sheriff's office and temp out at the end of the day. And so, those kinds of things are unusual for us, but it's all about ensuring that we are doing everything possible to protect our staff. And if your staff sees that, even engage your staff. We were talking earlier. Ask them what they think. This doesn't all have to be driven from the owner's level or the business CEO level. This can be driven at the lowest level where they know that they're being exposed, or there's somebody coming back from Texas on vacation and that puts them at risk and they're scared. Those kind of dialogues need to happen too. So there's a lot of things that we need engagement from those businesses right now. And for those that are essential, and we recognize the jeopardy that they're all in, and we commiserate with them. It's a tough time. So do everything you can to minimize that risk.
Wanted to ask about the PPE as far as shipments coming in.
Sure.
Do you have an estimated date for the next shipment?
No, we put a huge order in today. It's not yet been accepted, I assume, but it's been recognized. It's in the system. And this is quite a large order, trying to encompass, because there's been additional guidance from IDPH, including long care health facilities, the nursing homes and things of that nature. We're trying to make sure that we can help the numerous long-term care facilities in Black Hawk County as well. We've had several of them reach out. We've reached out to all of them. We were able to provide some PPE to them, but we've got everything from home health to visiting nurses, those kinds of folks too. So we're trying to get as much support out to everybody as we can, and we're running nearly out, if we're not already out. I'm looking at Lori when I say that, but I think the next shipment probably, if it follows the standard protocols, 2 to 3 days. So maybe as late as Monday of next week.
And with the governor's proclamation extending the banning of essential or non-essential dentist service and things like that, have you been getting any private things from businesses in town that are now sort of non-essential medical services?
We have not, but we have utilized some resources where if a dentist office was normally ordering procedural masks, now maybe we can tap into the resources that usually provide those to dentist office. So we are soliciting some different suppliers than what we would normally, or recommending suppliers in a different supply chain than what we've normally recommended.
Have you had luck on the private market?
I'm not going to say we've had a lot of luck, but we've had better luck at being able to just say, hey, I can't help you, to, hey, why don't you try here now? There's new creative ideas out there on where we can make recommendations. We try and spread that out.
What about the fabric masks? Have you been seeing any coming in?
We've had a few come in, and between, I think it was Unity Point was a drop-off, and then us, but they're going out just as quickly as we get them in. So we're appreciative of the effort, and certainly I know there's a lot of people out there working their fingers to the bone, helping us with that, and those are greatly appreciated.
And the governor, I think, accidentally mentioned that 4 facilities in Iowa, long-term care facilities, now had outbreaks.
Yeah.
Are there any facilities in Blackhawk County that you're...
I am not aware. Well, I'm concerned about all of them. I'm concerned about the jail. But there's a lot of assistance being provided to those facilities through Blackhawk Health and different organizations that focus primarily on those kinds of issues. And I do think that here in Blackhawk County, we were a little ahead of the game. And so being a few days premature and being a few days ahead of the curve was probably to our advantage. But you're only as good as your weakest link. And right now, like for my jail, I think my weakest link is probably going to be one of my staff members who just inadvertently comes in contact with somebody. And so we're playing really strong defense there. But yeah, I would say we're concerned about every facility right now, and there's just. This is an equal opportunity offender that it doesn't care as long as it can get in the lungs and spread, it's going to populate and it's going to spread. Yeah, absolutely. Any other questions? So we were listening very intently today at 2:30 as the governor spoke, and I think probably you'll note that on our speakers forecast, it says to be determined. I think probably we'll be inviting the superintendents from Cedar Falls and Waterloo schools, simply because we recognize if they're being extended through April 30th, this gives them the weekend to kind of make their plans, and hopefully this can be the venue where they can let us know. Obviously, our children are our greatest resource, and all the parents want to know what's going to happen, and hopefully by Monday there can be a plan for what happens with that last 30 days of what would be a traditional school year. So that's probably where we're going to be reaching out and trying to have for a briefing for you on Monday as well. So if there are no further questions, that concludes today's briefing. Thank you, folks.